How to refer to people with disability, disease, or disorder. It isn't proper to call someone by a disease or disorder when referring to people. Avoid victimizing them by their disability or disorder. For example, instead of saying Henry suffers from asthma, we should say Henry has asthma. Instead of saying paraplegic, we should say a person with paraplegia. Paraplegia refers to paralysis that occurs in the lower half of the body. Instead of saying a demented person, we say a person with dementia. Next is, instead of using retards or mentally retarded person, we should say a person with mental retardation. Remember, the focus should be on the person and not on the condition. For this one, we have to emphasize the individual, not the disability. Instead of saying a blind person, we say a person with visual impairment. There has been a heated debate among parents of children with autism about whether to use autistic person or person with autism. You may simply ask the concerned people what their preferred terms are. Yet again, research is necessary to become aware of the trends. But for this one, we always have to remember to focus on the person and not on the disorder, especially if we are not sure how to refer to them. Sometimes some people are fine calling themselves diabetic. It's their prerogative to identify themselves however they choose, but it doesn't mean it's acceptable for anyone else to assume it's alright. So we can also say a person with diabetes, especially if we're, again, not sure. Remember, always do a research. That is, in order for you to be updated with the trends. There are lots of information online. Or, ask the people concerned with their preferred terms. And last but not the least, be respectful. Our goal here is not to stereotype, insult, or demean people, but to show empathy and that we see them first ahead of their disease or disorder.